What are some of the critical points that maybe you and your doc missed when you were talking about your shoulder pain? As a physical therapist, when people come to us, they're obviously asking questions about how do I fix my shoulder pain, how long should it take, and what are the correct steps that I need to do moving forward. So when you first start having shoulder pain, what do? You start typing on Google, shoulder pain causes, what's causing my shoulder pain, search terms like that. Generally, the first thing that comes up is rotator cuff tear, rotator cuff injury, something along that sorts in terms of language. And this can definitely be really scary to hear the word tear and whatnot. So in this video, we're gonna actually focus on, in regards to shoulder pain, degenerative rotator cuff tears. So to define a couple of these terms, what is the rotator cuff? First of all, what that is if you think of your shoulder as a ball and socket joint, what surrounds the ball of it and holds onto it, gives support to the joint, is the rotator cuff. So it's actually a group of 4 muscles that all attach at that ball of the shoulder joint and bring support to it. Now what a tendon is, which is what a rotator cuff tear would involve, is the tendon of the rotator cuff. Is actually the piece of connective tissue that connects the tendon, or connects the bone to the muscle. There are a few mechanisms of injury for a rotator cuff tendon. One of them being acute, so something that happened that's very noticeable or very apparent that it happened and the injury happened in that moment, and then more of the gradual onset to where a tear would happen. These gradual onset ones are the ones we're talking about today, where they kind of come on over time naturally. So what type of person has the biggest likelihood of this type of thing happening? So if you have shoulder pain, you're trying to figure out what it is, would you fit into this category is a question that you should ask yourself. The type of person that would have a gradual onset of rotator cuff tear or tendon related pain is usually older, so 40 years of age or older. It's actually really rare to have a degenerative tear if you're under 40 years old. So if you're a younger person and you have shoulder pain that's come on gradually out of the blue, having it be a degenerative tear is a really low likelihood. If you do fit into this sort of age bracket, one other crucial thing to realize is that a lot of these types of tears are asymptomatic, meaning that your shoulder won't hurt necessarily, and you might, if you had an image or take an MRI or some sort of screen and looked at the tendon itself, there might be a tear in there even if you didn't have pain. So it is normal to have these sort of things pop up in each decade as you get older. Application-wise, what that means, and you always hear that saying, is a picture is worth 1,000 words. But in the case of an MRI for a shoulder in this sort of age bracket, in an asymptomatic population, you may have a tear that pops up on there even though your shoulder doesn't hurt. So in this case, it's not always worth 1,000 words, and it's not always a good indication of what's causing your pain or how much pain you have. So the amount of damage that shows up on that sort of screen doesn't always correlate to the severity of pain. So somebody might have a lot of damage that shows up and they'll have no pain, and vice versa. There could be very little damage that shows up on an MRI, but the pain could be very high. So if you have a confirmed degenerative tear, rotator cuff tear, what will happen in the future if nothing's done about it, or if you take a conservative route? So that means non-invasive, so non-surgical type of route to help heal your shoulder. For this video specifically, I'm actually referencing a study about degenerative rotator cuff tears and the natural history of what would happen. So if you want to read more about that too, I'll leave a link in the description of where to find that study. So for the study we're referencing for this video, of those people that had a confirmed tear, between 20 and 50% of them would have a progression in the depth of the tear, so the thickness of the tear. Usually when we're talking about a rotator cuff tear, it's about the depth of the tear, not how far across the tendon is it torn. In general, after about 3 years, some people will have a bit of a progression. Probably more importantly too is that those that had symptoms, those that had some shoulder pain and a confirmed tear, they were having a little bit more progression or at a higher rate. More people had that type of thing happen versus those people that were asymptomatic and had a tear. Only about 20% of those people had a progression in their degree of tear, whereas those with pain had a 50%. So 50% of those people had some progression in their tear. And even considering this progression in the amount of tear, 80% of these people were actually having improvement in symptoms over these years. So this is really zooming out like 3+ years and looking at what could happen in terms of the degree of tear and how symptoms change. So to recap, even though there is a progression in a lot of these rotator cuff tears or degenerative rotator cuff tears over time, there is actually improvement in a lot of cases in terms of symptoms and function. So how strong a person is and how much pain they're having. So something really positive to take away is that if we expand the time horizon pretty far, even with a degenerative rotator cuff tear, symptoms usually do get better over time and function usually returns over time. Even if it wasn't good at baseline, it can get better. And this is regardless, even though that there is a lot of progression in pathology for people. So regardless of having that progression in pathology, you can actually still have an improvement in symptoms, so pain complaint, or also have an improvement in function. So it's really important to consider that in that natural history of what could happen or what potentially will happen based on the data, so you can make a better decision about what should be done in relation to whatever diagnosis or shoulder pain diagnosis that you have. So many people might think that they need surgery immediately or opt for surgery, even considering this diagnosis, where if you expand the time horizon, it does look pretty positive. So it's important for us to know, and for us as rehab providers to explain these types of things to you so you can make the right decision. And a lot of times the docs, PTs, chiros, stuff like that, we skip over this type of information and just present a solution to help fix the symptom in the short term or with the goal of being long term. So hopefully this helps you consider your options. If you got something out of this or if you learned something, please hit subscribe and we'll bring more information like this to you guys at the channel.